Psoriatic arthritis is a type of inflammatory arthritis that causes inflammation with pain, stiffness and swelling in the joints you can see, like fingers, knees and toes, and it can cause inflammation in the back. It's linked to a skin condition called psoriasis. This causes dry, scaly skin that commonly affects the scalp, the elbows and the knees. About 1 in 3 people with psoriasis will develop psoriatic arthritis. Some people develop it before and some never develop the skin rash, but have the appearance and usually a family history. Psoriatic arthritis and psoriasis are autoimmune conditions, which means that for an unknown reason, the body has started attacking itself, causing the immune system to be overactive. People who have been diagnosed with psoriatic arthritis are usually managed by inflammatory arthritis specialists called rheumatologists. If you also have severe psoriasis, you may need to be referred to a skin specialist, a dermatologist, for additional treatment. The symptoms of psoriatic arthritis, in addition to pain, swelling and stiffness in the joints, which is worse in the morning and lasts for over half an hour, can sometimes cause problems in a whole finger or a toe to become inflamed and look like a sausage. This is called dactylitis. Psoriatic arthritis can also cause inflammation where the tendons attach to the bone. This is called enthesitis. The most common site of enthesitis to occur is around the hip, the knee, heel and underneath the foot. This can sometimes make it difficult to stand or walk. Occasionally the inflammation in joints and tendons may be severe and make it difficult to complete everyday tasks such as washing and dressing and other activities. Psoriatic arthritis can also affect the fingernails and toenails, causing small round dents to appear. This is called pitting. It can also cause your nails to become thicker, change colour and lift away from your finger or toe. This is called onycholysis. Having inflammation in the body can also cause general tiredness, which does not get better with rest. Having low energy levels can make it difficult to complete tasks you would normally be easily to do, and it can make your life a bit more difficult. Complications of psoriatic arthritis include making you more likely to develop other conditions, and we'll cover each one separately. The eyes, sometimes it can be linked to inflammation in the eye, which can cause pain, redness and changes in your vision. This is called uveitis. If you develop eye symptoms, you would need to seek urgent medical attention through either your GP, emergency eye appointments or local emergency departments. Uveitis can usually be managed with steroids under the care of an eye specialist called an ophthalmologist. Other areas include the heart, and surprisingly psoriatic arthritis can mean that you are more likely to develop heart issues. However, you can reduce the risk by making sure that you exercise regularly, maintain a healthy weight and diet, do not smoke, do not drink too much alcohol, and you should have yearly checks with your GP to make sure that your cholesterol levels are okay and have your risk of developing heart disease reviewed and assessed. Next is the digestive system. Having psoriatic arthritis can mean that you're more likely to develop inflammatory bowel disease called Crohn's disease or ulcerative colitis. Symptoms of this include blood in your poo, diarrhea of more than 7 days, regular pain and cramps in your tummy, high temperature and unexplained weight loss. If you notice any of these symptoms, then you should speak to your GP. Another area that it can affect is the liver. And having psoriatic arthritis can mean that you're more likely to develop fatty liver disease, which is caused by a buildup of fat in the liver. This is also called non-alcoholic fatty liver disease, or NAFLD. NAFLD can eventually cause permanent damage to the liver, called cirrhosis. Symptoms of liver issues include pain in the top right of the tummy, itching, extreme tiredness, unexplained weight loss, yellow discoloration of the eyes or skin, known as jaundice, and unexplained swelling in ankles or tummy. If you notice any of these symptoms, then you should speak to your GP. Another area that can be affected includes other organs, and you need to talk to your GP. If your GP thinks that you have any of these types of arthritis, they may refer you to a rheumatologist, a doctor who specializes in these conditions. Like me, the rheumatologist will ask questions about your symptoms before examining you. They may need to do some blood tests and x-rays to help with the diagnosis or other imaging. And you can have ultrasound scans or MRI scans may be needed. There's no specific test to diagnose psoriatic arthritis, but it can be treated. There's no cure for it, but there is a way of controlling the disease which is aimed at improving your symptoms. However, with the right treatment, symptoms can be very well controlled, helping patients live a normal life. And the exact treatment will depend on the severity of your symptoms, but the general principles are the same. We have firstly exercise, which will basically improve your pain and stiffness. Swimming and hydrotherapy are especially beneficial, as is cycling. 2, physiotherapy, and that is as well as occupational therapy and podiatry, and these are therapists that work alongside your team in rheumatology. A physiotherapist gives you advice about exercises that may improve your symptoms. An occupational therapist may be able to assist you with hand strengthening and can give advice and gadgets for self-help, like jar openers, easy grip utensils or walking aids, and this can help you have your mobility better at home. A podiatrist helps with foot care and advises on special insoles and supporting footwear for you to have. And last is medications, which is where the doctors and the nurses come in. And anti-inflammatory medications like naproxen and ibuprofen help to reduce the pain and swelling in the joints. They must always be taken with food to reduce the risk of side effects, including gastrointestinal ones. And some people find that anti-inflammatories make psoriasis worse. If this happens to you, please tell your doctor. Steroids can be used, and they can be given as tablets, injections or infusions. They're not a long-term treatment, as they can cause complications like weight gain, high blood pressure and bone thinning. The big treatment for us is disease-modifying drugs, or DMARDs, and these happen after you have the anti-inflammatories, and it suppresses the immune system in the long term. They act in a bit of a longer time scale, and they're a group of medications which can be used to treat the disease. They reduce inflammation in joints and work very well for reducing damage. Examples of DMARDs include methotrexate, sulfasalazine and leflunomide, and we occasionally use cyclosporin. When you take a disease-modifying drug, you'll need regular blood tests and occasionally blood pressure checks and urine tests. These tests allow your doctor to monitor the effects of the drug on your system and also check for possible side effects. Finally, we'll talk to you about the newer drugs, which are biologics, where you have very severe inflammation in your back and in your joints, and you might need those. And biologic medications also suppress the immune system, and they are much more potent than disease-modifying drugs. And they're usually given as injections, although some are tablets. And they can be prescribed on their own or in combination with disease modifiers. And some examples include anti-TNFs like adalimumab, infliximab and etanercept, certolizumab and golimumab. You also use IL-17 inhibitors including secukinumab, ixekizumab and bimekizumab, IL-23 inhibitors like ustekinumab, and the newer tablets, the JAK inhibitors such as tofacitinib and upadacitinib. It can take a while for these medications to start to work, but we will assess their response at least 3 months into disease. It's important to continue to take them if you don't feel the effect within a day or 2. Your rheumatologist will speak to you in detail about which medication will be the best for you. Very rarely the inflammation in joints can be so severe that it permanently damages your joints and tendons. If this happens and your symptoms are severe, a joint replacement or tendon repair operation can be considered. Lastly, we need to talk about the skin. The treatments for psoriasis include ointments, creams and gels. If your psoriasis is severe, you may be referred to a skin specialist, and light therapy could also be done to help manage the skin disease. The outlook for patients with psoriatic arthritis with early diagnosis and the right treatment, we would expect that the symptoms to improve and for patients to live a good quality of life.